Great pleasure for me to introduce the following videotape. The pleasure is twofold. First of all, it concerns a project that was financed by Rotary International. And the financing is provided for a period of 10 years, which means that it allows not only to run the project of training, but also to do the evaluation of the project. And of course, that research aspect of the project is of great interest to us. The second reason why it's a pleasure is that it concerns students of high school. We want to teach them how to recognize an emergency, how to give alarm, and how to give first aid. All these gestures will give the victim of a sudden illness or or trauma an extra chance of survival. Now, to be able to do that, this requires skills, both manual skills and mental skills. And to acquire these skills, training has to be provided in a way that the skills will last forever, for the whole life. And the only place where we acquire skills that we use the whole or throughout our whole life is in school. Schools are for teaching. So this is the reason why this program is very important, because it will allow us to give to students of high school the necessary skills to be able to intervene properly for the rest of their days.
In Western countries like Belgium, dying by a sudden cardiac arrest is still the most important cause of death, even more important than cancer or a fatal traffic accident. Cardiac arrest, or better the absence of circulation, means the absence of an efficient blood circulation throughout the body. In the majority of cases, a sudden death with visibly healthy persons is based on a heart attack due to an interruption of the heart rhythm, mostly based on an acute heart muscle attack. Examination shows that in such cases, due to circulation stop, death enters very fast, that is, within 3 to 4 minutes. This almost instantaneous death mostly occurs outside the hospital, before medical help could be called. That's why the coincidental witness at the place of the incident, often a coincidental bystander, even without any medical or paramedical teaching, is of crucial importance. This person can be very important for the survival of the victim by taking a number of measures. These measures, taken either at home, at school, or at any public place, are the following. Judge in time the seriousness of the situation. Quickly inform the emergency department by calling the general number 100. Start accurately, within 3 to 4 minutes, the elementary treatment of the heart and breathing arrest, in order to keep an artificial blood circulation and breathing until the specialized medical assistance arrives. This treatment is called cardiac pulmonary resuscitation, trying to bring dying people back to life. To ensure enough bystanders who are able to take effective action within 3 to 4 minutes, a large part of the population has to be trained in the basics of resuscitation and be able to call out the right medical support. 40% of those victims can be saved when you start up the basic resuscitation correctly within 3 to 4 minutes, followed by a fast and efficient treatment by the medical team. These are the reasons why these basics will be taught. Schools are for teaching. We can't live without oxygen. We take up the oxygen via our respiratory center. The lungs give oxygen to our red blood cells. The heart function ensures the blood circulation and leads the oxygen to all our body cells that can't function without it. The stopping of the breathing and all the heart function means a serious threat to vital organs like the brain. An effective heart compression or rescue breathing, that is, starting cardiac pulmonary resuscitation, has the aim of getting enough oxygen to the body cells until the medical support arrives. Basic life support, or the support of the basic functions of life, requires a correct sequence of treatment and is the elementary step in the chain of urgent medical assistance. Basic life support consists of a series of acts which have to be executed by or instructed by the first responder. The first responder has to execute those acts in the right order. Ensure a safe situation. Check the victim's consciousness. If he's unconscious, check breathing. Call for help by phoning. Start rescue breathing if necessary. Check the heart function. If there are no signs of the heart functioning, start heart compression in combination with rescue breathing. Continue until qualified help arrives or until the victim shows signs of recovery. These guidelines will be illustrated by examples. Ensure safety of rescuer and victim. Check the victim and see if he responds. Gently shake his shoulders and ask loudly, "Are you all right?" Pay attention to the neck vertebra. If he does not respond by answering or moving, shout for help. Then clear the airway by tilting his head back and lifting the chin. Place your hand on his forehead and gently tilt his head back. With your fingertip under the point of the victim's chin, lift the chin to open the airway. While you keep the airway open, look, listen, and feel for normal breathing. Look, listen, and feel for no more than 10 seconds. If he's not breathing, send someone for help. Or if you're on your own, leave the victim and go for help. Return and start rescue breathing as below. Give 2 slow, effective breaths, each of which makes the chest rise and fall. Ensure head tilt and chin lift. Pinch the soft part of his nose closed with the index finger and thumb of your hand on his forehead. Open his mouth a little, but maintain chin lift. Take a deep breath to fill your lungs with oxygen and place your lips around his mouth. Make sure that you have a good seal. Blow steadily into his mouth whilst watching his chest. Take about 2 seconds to make his chest rise, as in normal breathing. Maintaining head tilt and chin lift, take your mouth away from the victim and watch for his chest to fall as air comes out. Take another breath and repeat the sequence as above to give 2 effective rescue breaths in all. Check the victims for sign of a circulation. Check the carotid pulse. Take no more than 10 seconds to do this. If you're confident that you've detected signs of a circulation, continue rescue breathing until the victim starts breathing on his own. About every 10 breaths, or about every minute, recheck for signs of a circulation. If there are no signs of a circulation, or you're at all unsure, start chest compressions. With your hand that is nearest to the victim's feet, locate the lower half of the sternum. Using your index and middle fingers, identify the lower rib edge nearest to you. Keeping your fingers together, slide them upwards to the point where the ribs join the sternum. Slide the heel of your other hand down the sternum until it reaches your index finger. Place the heel of the other hand on top of the first. Extend or interlock the fingers of both hands and lift them to ensure that pressure is not applied over the victim's ribs. Position yourself vertically above the victim's chest and, with your arms straight, press down on the sternum to depress it between 4 and 5 centimeters. Then repeat at a rate of 100 times a minute. After 15 compressions, tilt the head. Lift the chin and give 2 effective breaths. Return your hands without delay to the correct position on the sternum and give 15 further compressions, continuing compressions and breaths in a ratio of 15 compressions to 2 breaths. Continue resuscitation until qualified help arrives. The victim shows signs of recovery. You become exhausted. If the victim starts to breathe normally on his own, turn him into a recovery position. Follow the next guidelines. Kneel beside the victim. Place the arm nearest to you out at right angles to his body, elbow bent, with the hand palm uppermost. Bring his far arm across the chest and hold the back of the hand against the victim's cheek nearest to you. With your other hand, grasp the far leg just above the knee and pull it up, keeping the foot on the ground. Keeping the hand pressed against his cheek, pull on the far leg to roll the victim towards you onto his side. Adjust the upper leg so that both the hip and knee are bent at right angles. Tilt the head back to make sure the airway remains open. Adjust the hand under the cheek, if necessary, to keep the head tilted. When do you need to get help? When more than one rescuer is available. One should start resuscitation, while another rescuer goes for help immediately. The single rescuer should normally assume that he has a heart problem and go for help immediately when it's been established that he's not breathing. However, if the likely cause of the unconsciousness is a breathing problem, as in trauma, drowning, or if the victim is an infant or child, the rescuer should perform resuscitation for about 1 minute before going for help. By telephone, a mobile, an emergency telephone, or a telephone booth, you can call the free number 100 or 112. Remain calm and pass on the right information. What's really important when you're calling the rescue number 100 is the location, the right address, the house number, the name of the street, the right name of the village or city, but also the condition of the victim. How many victims are there? Are they conscious which injuries do they have? That is the most important information. Keep calm, act clearly, concisely, and return to the victim. We will now show you a few examples.
Gaat het niet meer, gaat opbouwen.
Pas op, Erik. Even dronken.
Hij is bewusteloos, maar ja, nog, buiten 100.
Een vriend van Isegem. Het is een ongeluk gebeurd in de Leeuwerikenstraat. Er is één bewusteloze Mariade.
Loopcentrum 100 Kent, ziekenwagen Zottegem ter plaatse verkeersongeval. Ik licht u in op de bijstand van de verhoor is. Over.
Hij is bewusteloos, maar zijn polsslag is er allemaal in zijn hoofd.
Hallo. Hallo. Begin mij.
Dear students, we, the emergency department, are counting on you to be able to arrive on time in the event of an emergency. You can be the first, most important link in the chain of survival.